I'm Dr. Devyani Barve. I'm a plastic and cosmetic surgeon and I practice in Mumbai. In this video, I'll be talking a little bit about a common procedure which we perform and which is asked for by patients. That's a rhinoplasty. And specifically, I'll be talking about how to care for yourself after a rhinoplasty has been done. So rhinoplasty is done as a one-day procedure in which I send patients home either the same day or early next morning. So a lot of the post-surgical care will be done by you at home. Even though that sounds a little difficult, it's not. So after a rhinoplasty, you will be sent home with some tapes on your nose and with a small splint. So a splint is basically something which is used to hold your nose in place. During a rhinoplasty procedure, we will do some alterations to your underlying bony framework and the cartilage framework. At the end of the surgery, the cartilage and the bone will be set in its place and the skin is draped over this framework very gently. So now to hold all this work which has been done together and make it cohesive, we put tapes on your skin and put a splint on top of it to make sure that it stays all in one place. So you have to be careful that there is no injury or there is no trauma to your nose after surgery. You don't sleep on your side such that your nose takes the weight of your head. You try and sleep a little upright so that your nose is in a more breathing efficient position. When it comes to taping, the tapes which are put after the surgery generally will stay in place very well for 5 to 7 days. After that, if the tapes start becoming loose or the splint starts becoming loose, I always advise patients to come and show me because it's the best way to replace the splint or the tapes as required. However, if suppose you can't come to the hospital for some reason or we are not able to meet, then there are ways you can change the tapes at home and change the splint as well. It is most important to remember that you do not use any force while doing this. So what can be done is you can use olive oil or some almond oil or any kind of non-fragrant coconut oil and dip a earbud in it and gently use it to tease the tape away. It doesn't cause your skin to become red or irritated once it's removed. So gently with the coconut oil, just tease the tape off your nose and along with the tape, the splint will peel off. It's as simple as that. The point is to do it very gently and as if you were handling a little flower. After that, there is a taping method in which you can replace the tapes. Now, there are surgical grade, very nice tapes available. So don't use the tapes which you get normally for fixing dressings or don't use band-aids. They are irritable. There are very nice surgical grade tapes available, which we will of course tell you about. So don't use over-the-counter tapes or band-aids because they can cause trauma to your skin and the adhesive can sometimes react with the skin and cause it to become red. These tapes are applied from top to bottom in a very graded manner. A shorter tape on top, then a little longer one and then a little longer one. Again with medium but gentle pressure. If work has been done on the tip of your nose, then there is another way to apply the tape in a looped format, which also I will explain a little later on. On top of this, there are very nice moldable aluminum foam splints which are available, which you just place on the top of your nose and press it down to give it the shape of your new nose. Now I know this sounds a little daunting and you feel that how will I do this? Remember, it is not something which you routinely have to do. However, you may need to do it once in a while, so it's good to know how to do it. When it comes to taking care of the skin and the rest of your nose after the splint has been removed, again, remove the tapes with a gentle earbud which has been dipped in olive oil or some kind of oil as a lubricant and peel it off. Make sure you massage your nose very gently. No pressure, no twisting, no turning the nose, however you may be tempted to do it. So gentle pressure from the top going down the side, same for the rest of the nose and continues till the tip. If some kind of tip work has been done, then a little pressure at the base and on the tip may also be required. These are simple techniques which let you mold the nose and more importantly the skin of the nose so that the swelling goes down and your recovery is faster. Rhinoplasty is a procedure which takes time to show results. You will see the initial result in about 2 to 3 weeks once the swelling has gone down. Know that the nose shape will keep changing over the next 3 to 6 months and can take up to a year at times, especially if the skin of the nose is thick. So be patient, keep massaging and molding your nose as has been explained by your doctor and make sure you keep the patience to see the final result of your nose, which will be very evident and very beautiful at the end of an ear. Another thing to remember is that if you have an important function coming up, like a wedding or some kind of a major event, do not consider a rhinoplasty 1 to 2 months before that. It takes time. So please consult a surgeon at least 6 months to a year before your major event so that the results are perfect in time for it. So if you found this video helpful, do like it and share it with somebody who may benefit from it. Please don't forget to subscribe to our channel. Thank you.